In the series finale of our coverage on HIV/AIDS, Insite is a supervised injection facility on the worst block of Vancouver's Heroin district. Here, nurses give clients clean needles to inject illegal drugs. Researchers have proven the facility is effective at cutting HIV infection rates in the area, but the facility is not without controversy. Critics argue Insite only promotes illegal drug use.
Vancouver, Canada has been called the jewel of the Pacific Northwest. But there is a darker side to Vancouver. More than 4,000 intravenous drug users live in the downtown east side. The alleyways around Hastings Street are open drug markets and shooting galleries.
This alley has a lot of memories.
Former addict Richard Teague has been HIV positive for 24 years.
When you're an addict and you want to get your hit into you, you go to the closest spot. And this is it, this alley right here. You know, you want to, get your fix in you, and you didn't want to wait. You wouldn't wait, try and find a room. You went to the nearest place where you could be kind of out of sight, and do your fix and get your high.
The community responded by creating Insite, North America's first supervised injection facility.
When people are seriously addicted and their goal is that they're going to use the drugs irrespective of what we say, your focus then becomes on, if you're going to use this drug, how can we do it in a way that is safer, reduces the risk of infection, reduces the risk of getting significant wounds, reduces the risk of actually this individual putting demands on other aspects of healthcare.
Insite has 12 injection booths, where clients use their own illegal drugs under the supervision of healthcare professionals.
Water here, which is sterilized.
Clients are provided with clean needles, pure water, and supplies to clean wounds. When Richard was using heroin, Insite was his safe haven.
I know Insite's been a godsend for Vancouver and for a lot of people, because I know some weeks at Insite, they probably saved 10, 15 people from ODing.
One of the things we have done significantly is the growth in new HIV infections and Hep C infections has receded significantly. I think for HIV, we're probably somewhere in the region of about 70%.
But Insite has its detractors. Prime Minister Stephen Harper and Conservatives in Parliament want the facility closed.
There have been multiple studies on these types of institutions like Insite in Canada or others in Central Europe. And some suggest there are public health benefits. Others suggest there are significant public health detriments in terms of increasing rates of addiction.
Dr. Julio Montaner says that healthcare professionals who created Insite were skeptical that it would reduce HIV infection.
Time and time again, the data came in saying, yes, it helps, and no, none of the concerns that me and my colleagues and the community at large have expressed had materialized.
Today, life for Richard is about balance and serenity.
Well, you know why I like this park? The reason I like it, as you can tell from just looking around, it's very serene. For me, it was a break away from the street scene, being in the back alley, beside a dumpster. I still deal with stigma because of my HIV, and I've been very open about it. But best advice that I can give somebody is you have to have a tough skin. I can't change it. You can't change what happened. You just got to learn to live with it.